If you've ever wondered what really happens during a dental appointment, not just the basic but everything, this video is for you. Today, I'm going to show you exactly what happens during a dental appointment, step by step. Hi everyone, welcome to OraCore. In this video, I will walk you through a complete dental visit, from check-in to diagnosis and treatment planning, so you know exactly what to expect. Let's get started. First, when you arrive, you check in at the front desk. They may ask you to update your medical dental history, medications, or insurance information if it's your first time. This is important because your overall health affects your oral health. After checking, a dental assistant or hygienist will call your name and bring you to the treatment room. Then you will be seated in the dental chair and they will begin preparing you for the visit. They may review your medical history again and ask you if you have any pain or concerns. Once you're seated in a dental chair, the next step might be dental x-rays. The most common x-rays are small x-rays taken inside your mouth. Why x-rays are so important? X-rays are very important because they allow us to see things that are not visible during a regular exam. These help detect cavities between teeth and evaluate the bone that supports your teeth. They are usually taken once a year or depending on your risk. Another type is a panoramic X-ray. This is a larger image that shows your entire mouth, including all your teeth, jaw, and surrounding structures. It's very useful for evaluating wisdom teeth and overall oral health. In some cases, dentists may also use 3D imaging for more complex situations. Dental X-rays are safe and use very low levels of radiation. In many modern clinics, protective aprons are not always required because the exposure is already very low. However, some offices might still use an apron, especially for added comfort or in specific situations. Next, the dental hygienist often begins by examining your gums and soft tissues. They also perform an oral cancer screening by checking your tongue, cheeks, lips, and other tissues for any abnormalities. After that, the dentist performs a clinical examination. The dentist will evaluate your teeth and overall oral health by checking your head and neck area and perform palpation, gently feeling the jaw, lymph nodes, and other surrounding structures. This helps detect any signs of infection, swelling, inflammation, or other conditions that might not be visible. Remember, early detection is key, especially for conditions like oral cancer. What's periodontal chart? In many visits, especially comprehensive exams, a periodontal chart is completed. This involves measuring the gums around each tooth. These measurements help detect gum disease and are part of standard clinical guidelines. You may hear numbers and feel some tiny pressure inside your gums. Remember, your mouth is connected to the rest of your body. So this exam is not just about your teeth, it's about your overall health. After the exam, dentists and hygienists will discuss their findings: cavities, gum disease, sensitivity, healthy mouth. If any issues are found, the dentist and hygienist will create a treatment plan. This includes what needs to be done, the order of treatment, and follow-up visits. For example, fillings, deep cleanings, crowns, referrals to a specialist. In some cases, you may be referred to a specialist if needed. Then comes the cleaning. The hygienist removes plaque and tartar, polishes your teeth, and flosses. You might feel pressure, but it shouldn't be painful. If your gums are healthy, you will receive a routine dental cleaning. It's also called prophylaxis. This is usually performed by a dental hygienist. Based on your gum health, the appropriate type of dental cleaning will be recommended. The number one type is called routine cleaning, also known as prophylaxis. This is for patients with healthy gums. It removes plaque, tartar, and stains above the gum line. Remember, you may feel some pressure, but it shouldn't be painful. The number two type is called deep cleaning, a scaling and root planing treatment. This is recommended when there's a gum disease. It involves cleaning below the gum line to remove bacteria and helps the gum heal. Sometimes this is done in sections and might require local anesthesia. We also have periodontal maintenance, which is performed after a deep cleaning. This is a regular cleaning performed more frequently to maintain gum health, between 3–4 months appointments. The number 4 type is called gross debridement. It's performed in cases where there's heavy buildup and measuring your gums or checking for cavities is impossible. Then a gross debridement may be done first. This allows better evaluation and prepares the mouth for a proper cleaning. Remember, the type of cleaning depends on your gum health. Not everyone receives the same treatment. That's why your dental visit is personalized based on your specific needs. In this step is the perfect time to ask any questions you still may have. For example, do I really need this treatment? What are my options? Will it hurt? How urgent is this? Once everything is completed, your visit will come to an end. Before you leave, the front desk will help you schedule your next appointment. This could be your routine checkup, a follow-up, or a treatment visit if something was found. They may also review your treatment plan, including any recommended procedures and timing. Don't be afraid to ask questions. Understanding your treatment helps you feel more confident and comfortable. A dental visit is not just about treatment, it's about understanding your health and feeling confident in your care. Understanding each step of your dental visit helps you reduce fear and improve your overall experience. Now you know exactly what happened during a dental appointment, step by step. If this helps you, make sure you like, subscribe, and share. And I will see you in my next video. Bye!